My name is Bhanu Telugu. I'm an associate professor at the University of Missouri, Columbia. I'm also a founding member and president and CEO of a startup company called Renovate Biosciences, which is located in Maryland. I am a recipient of Corridor Research Foundation grant mechanism that allowed us to develop an animal model, specifically a pig model for CHM. And our goal is to develop therapies that can be readily translatable to human patients. This is the first grant we received from the Corridor Research Foundation. This is, in terms, it's a seed funding to essentially get us started in developing the animal model. Our hope and expectation is that once we get some of the preliminary data in place, we could actually leverage this model to develop funding from Department of Defense or National Institute of Health that will allow us to accelerate adoption and the timely development of therapies using this model. And in this regard, the funding is essential because most of these funding agencies don't fund essentially to make the model. So in many ways, this was a catalyst for us to kind of like give the spark for us to go after this model. And now that we're part committed, we will take it forward from here. Yes, this is the first time I'm attending the CRF meeting. As a funder, I was requested to come and give an update on the research. And in many ways, I'm glad I came because it's a good educational opportunity for me as well. It's one thing to say we're working on a disease, but then to see the patients and more importantly, the family with them, it just gives a different perspective. It essentially adds meaning to what we do and gives us a greater purpose of what we're trying to do. So I'm going back with a greater purpose, kind of re-energized and more focused, and hopefully we'll bring this to fruition pretty quickly. As I mentioned earlier, I'm a veterinarian by training. I came to the US with the goal of developing my career more so in the same lines of what we are doing right now. The goal of setting up a company is essentially to enable translatability of findings, and I see that as more of an enabling platform for most of the patients, most of the companies who wants to work with us. That has been the goal with founding the company, and I'm involved with this and a few other disease models. So it's been hugely rewarding, and I hope to continue the good work. And I could add that we probably would be, once we have the model validated and characterized, I think we would be on a timeline which would be much shorter for developing therapies that are translatable to human patients. Thank you for the invitation.